Hey Tim, we have another Medicare supplement or Medigap rate increase today that we're going to be talking about. Recently, we had spoken about the largest Medicare insurance provider raising their rates. Today, we're going to be talking about the second largest, and this rate increase, well, I think you had told me it's the largest you've ever seen. So we wanted to do this emergency podcast. This is pretty serious from your perspective, right?
Yeah, absolutely. It's urgent. It's Sunday morning on April 6th, and I wanted to get this information out for people because seniors are already being slammed with increasing costs of living. Homeowners insurance in Northern California, where I am, is going through the roof, and savings rates are down on CDs, and now the stock market's melting down. Now I have to go to my clients and deliver a 15% plus rate increase. The rates I'm seeing, and this is the second largest med sup carrier, also known as Medigap carrier in California, in by some measures, and they're going to be having a significant rate increase soon.
It's pretty shocking, these numbers that we're seeing. I know we had spoken about it a little bit before, but are you still of the belief that this is because of increased utilization after COVID, or what is the cause for these increases if there really is one that's transparent?
It's a little bit hard to say. I mean, there's the standard answers like medical inflation and, wages, cost of supporting medical staff and doctors, increased utilization post COVID. That's probably the main one. I've never seen a rate increase this high on open plans being sold. I've seen high rate increases on closed plans where a carrier jacks those rates up really high, but usually they're giving the people the opportunity to move to the open plans. It's a difficult situation for seniors. A lot of people who have a Medigap plan, they don't want to give that up. I talked to a client the other day, asked how she was doing, and she said, "Well, I'm not doing well. I've got 5 upcoming surgeries, and I don't want to lose my coverage." I felt really bad for her. As people get up in their 70s, mid 70s, and 80s, they're dealing with a lot more health conditions, reluctant to give up a Medicare supplement plan or even change the plan. In fact, this client mentioned, "Oh, well, what about, I don't pre-existing conditions. They're not going to cover my pre-existing conditions." And so there are a lot of misconceptions that people have, particularly here in California, where we have the birthday rule,
Right.
about their Medicare supplements, Medigap plans. I'm trying hard to educate clients and show them it's safe to change their supplement. And we've been saving people, Jack, between, for singles, maybe 50, sometimes $75 a month on their premiums, occasionally more if they're on a closed plan. Get people on the most competitively priced plan, but some people don't want to deal with it. They don't communicate with us. It's challenging in those ways, but I've seen couples where we're up close to $200 a month in premium savings. That's significant. And I'm talking about either the same or taking one step down, like from plan F to a plan G or a plan G to a plan N. People have a lot of misconceptions about Medicare supplements that we want to try to clear up.
Yeah, and it's difficult, right? Because if you think about it, there are a lot of mistakes that you can make when you're changing your plan. It's not every move is the right one, but there are things that you can do that are safe. There's things that you can do that are going to save you money and that aren't going to compromise your benefits. Now, if you get on the phone with a random call center in Florida trying to sell you a Medicare Advantage, they're probably not going to be helping you in that way. But if you get in contact with a good local agent such as yourself, you can help people save money in a way that's not going to compromise their benefits there. And I think it also highlights an important thing. The insurer increasing these rates, a lot of people, if they were to check and compare rates, they probably could get something more competitive. So it's definitely very important that every birthday you're looking at your comparisons and you're seeing if there's a better option, because with these rate increases like this, you can't really afford to just sit idly by and continue to be on the same plan anymore. That's not really a luxury that most people have unless don't care about a huge increase like this.
Yeah, definitely. And what a lot of people don't, there's some things I'll just touch on here about misconceptions,
Yeah.
like I mentioned. So, Medicare supplements are required to offer standardized medical benefits. So, if you have a Plan F, the most comprehensive Medigap plan, and you move to another carrier's Plan F, it's going to have the identical medical benefits that your current Plan F has. It's going to plug up all of the 6 gaps in Medicare's medical coverage, the 3 on the Part A side, the hospital side, and 3 on the Part B side. So you're going to have the same medical benefits. So you're not going to give anything up in terms of the medical benefits, which is the core part of an insurance plan. The other thing is that there's no unique provider network between the different Medigap plans. So there's no more Aetna network and Anthem network and United Healthcare network or Blue Shield network. You, with any Medigap plan, you can see any Medicare provider anywhere in the country that agrees to see you. They're not going to give up medical benefits if they keep the same letter plan. Standardized medical benefits are going to be there for them,
Right.
and they're not going to lose their doctors or hospitals that they can receive treatment at. So people they worry about that. If they have a specialist and they're managing their complex health issue, they want to make sure they can continue to see that provider. The third thing I'll mention is part of the reason that people really want to maintain a Medicare supplement as opposed to a Medicare Advantage plan is that the Medicare supplement plans cannot require prior authorization. If Medicare covers a procedure or a test and your doctor recommends it, then the Medigap plan has no discretion to require a prior authorization or to delay or deny care. If people are able to move to the same letter plan, they're going to have the same benefits. The Where we do see some differences, and this is where a good broker comes in, is on some discounts, some spousal or household discounts, because there is a fair amount of excuse me, variability between carriers on the type of discounts they offer, the variability, and also the gym benefits. A lot of California Medigap plans have a free gym benefit. A lot of other states don't have that on their Medicare supplement plans. A lot of times people, particularly as they get older, they're really not utilizing those gym benefits. And so going to a plan that doesn't offer a gym benefit is usually not a big deal. But if it is, that should be taken into consideration.
And you're having trouble with your Medicare or you got a letter about an increase, get in contact with Tim. This is somebody that, really can help you. And like you said, all of these things should be taken into consideration. If you can get the gym benefit and you're going to be going to the gym regardless of whether or not you have this gym benefit, well, that's essentially a discount for however much the cost for your gym is, if it's covered by that company, or if you have the spousal discount. All of these little things at this point, with everything being so expensive, like you mentioned, and people's savings potentially, if they're in the stock market, could be experiencing a downturn at this time. You really have to be considering all of these different discounts, and really dialing in your insurance as much as you can, because every dollar counts in these situations. There's an opportunity to save more than just a small amount of money. You can save a good chunk of money if you make the right switch and don't sacrifice anything, depending on how you manage your switch. And I think
Yeah.
it would give people a lot of, I think they would feel a lot more comfortable with doing these changes to their plan if they got to sit down and talk to somebody, whether it be in person or on the phone, about these things, and not have to do it on your own. An insurance agent is, you don't pay. So that's not an extra amount that you're tacking on to your insurance to be working with somebody. You're saving money and it's free. If you have questions, I would definitely recommend getting in contact with Tim and working on that and seeing if you can save money.
Absolutely. Let me summarize before we wrap up. I'm located in Northern California. Last year the rates went up above average on Medicare supplements, again, also known as Medigap. They went up fairly high, higher than what the averages were. Certainly during the pandemic, they didn't go up as much. But last year they went up. So 2024 was a fairly significant rate increase. Now we're being hit first from the, kind of the largest Medicare supplement in California carrier, with like 14% in a lot of areas on the most popular plan. So I was like, wow, that's really not great for our clients. And then so the second largest carrier in California they haven't even really officially released the rates to the agents yet. They're just rolling out, but we've got taken a look on a case by case basis. And those rate increases that I'm seeing again on popular plans, on open plans, as between some of them 17 to 20%. That's significant. It's going to be difficult for people, really hurt. The first thing we do in California, I'm licensed in about 14 other states, most on the West Coast. We have the birthday rule. The birthday rule is crucial. It's offered in quite a few states, and that's becoming more and more of a thing. But with the birthday rule, you can move to a different carrier that offers Medicare supplement plans equal or a lesser plan without having to answer any health questions within a certain period around your birthday. Usually you have up to 60 days after your birthday to move to a different carrier without having to answer health questions. So my client who was having the 5 surgeries. Her birthday is in July, and she said, "Well, let's just wait till July because there's no way she's going to pass underwriting." That's the other thing that people need to be aware of, is that a lot of people think that they can change their Medicare supplement in the fall during the annual election period, annual enrollment period, and that's just simply not the case. You can apply to change your Medicare supplement plan at any time during the year. But in California, where we have the birthday rule, if you do it outside of your birthday rule period, you have to answer health questions. We've been getting a lot of people approved even after health questions, because you don't have to be in perfect health. I mean, somebody who's got 5 surgeries pending, they wouldn't be approved through underwriting. But we had a guy who's in pretty good health, but he takes 3 medications, and we were easily able to get him approved. So it is possible for people to go through underwriting, and if they're in reasonably good health, don't have anything major pending, then it's a good idea to look at it, because we're trying to get out in front of those rate increases, lock in lower rates for the next 12 months. A lot of plans have a 12-month rate guarantee. We reached out to clients in their birthday rule period. I mean, we do that on a regular basis anyway, but the ones that didn't respond, that had birthdays, say in mid to late February, March, April, May, June, we're reaching out to them about, hey, you're going to be in for a significant rate increase, and make sure they have an opportunity to take advantage of that birthday rule so they can save some money and retain the same medical benefits. So I do want to touch quickly on, hey, if you have a plan F, and we've communicated with our clients numerous times, hey, look at a plan G, because they're almost identical, except Plan F pays the small annual Part B deductible, which this year is $257, and Plan G does not. Other than that, the medical benefits are identical. And if we can save you $400, $500, $600 a year for a Plan G over a Plan F, the math works on that. You pay that deductible, and then you end up saving another two, three, $400 for
Yeah,
the year. 2025, for anybody on a G or F plan, is worth a close look. It plugs up all the gaps on Part A, a hospital, just like a G or F. On the Part B, the medical insurance, you have small copays and excess charges, which is extremely rare. Would have to deal with an excess charge, but the premiums are lower. Talk to an experienced agent. A good agent is just simply going to try to work hard to save you money and earn your business and keep you as a client. None of these, none of these changes are going to make or break an experienced good agent. So take advantage of that. That's free, and you're gonna get great guidance and maybe save money. That's my pitch about using a good, experienced independent agent that
definitely.
works with Medigap.
Definitely. And we'll put your information there. Tim, thank you for making time on this Sunday about the gap rate increase. You always want to help your clients, so you made time for us today. I appreciate that. I hope you have a great rest of your day.
You too. Thanks, Jack.